When patients undergo lethal dose chemotherapy and radiation prior to a bone marrow transplant, the treatments indiscriminately destroy rapidly dividing cells across the body. A common and severe side effect of this cellular destruction is oral mucositis. The mucosal linings of the mouth and gastrointestinal tract break down into deep ulcers, causing intense pain that impairs eating and poses a high risk of systemic infection in an already immunocompromised patient. To combat this tissue degradation in pediatric leukemia patients, researchers introduced a highly specific intervention. Beginning the day after the final dose of chemotherapy, patients received a daily application of a 688 nanometer light-emitting diode array, delivered at a strict fluence of 4 joules per square centimeter. These charts display data from 3 pediatric transplant patients undergoing targeted light therapy, measuring mucositis severity and pain intensity. Instead of severe ulceration, the progression diverges. Mucositis lines flatten, remaining mild, while pain intensity spikes level off and drop sharply. Despite receiving highly toxic drugs like melphalan, these patients could tolerate oral feeds, converse, and required infrequent use of morphine. This rapid tissue salvage is directly driven by quantifiable photobiological mechanisms. The cells are responding physically to specific wavelengths of light. By deconstructing the empirical data, we trace exactly how 680 to 880 nanometer light alters cellular behavior, accelerates macro tissue repair, and opens vectors for targeted oncology. The origins of this technology are rooted in orbit. NASA needed a reliable method to grow sustainable plant life in microgravity. Traditional lighting solutions like halogen bulbs or lasers draw too much power and emit too much ambient heat to be safely utilized in close quarters. To solve this, engineers developed highly energy-efficient, low-heat LED arrays capable of emitting intense, targeted wavelengths. During these orbital botany experiments, scientists handling the plant growth chambers made an unexpected secondary observation. The minor skin lesions on their hands were healing at an accelerated rate. In a microgravity environment, human tissue regeneration typically stalls, and muscle atrophy accelerates. An environmental factor actively promoting rapid wound closure in space was a massive physiological anomaly. To understand exactly how these diodes were overriding the cellular degradation of spaceflight, researchers moved from orbital observations to rigorously controlled terrestrial models. To test the boundaries of this effect, researchers utilized a Sprague-Dawley rat ischemic wound model. By placing a physical barrier beneath the skin to block vascular growth, they created an oxygen-starved environment that mimics the severe pathology of chronic, non-healing human wounds. The subjects were divided into 4 cohorts: a control group, a group receiving only hyperbaric oxygen therapy, a group treated exclusively with an 880 nanometer LED, and a final group receiving a combination of both oxygen and LED treatments. This graph tracks the 14-day healing trajectory. By day 7, a critical divergence emerges. Wounds treated with combined hyperbaric oxygen and LED therapy measured 36% smaller than the control. Even without supplemental oxygen, the LED alone achieved a 20%. Specific near-infrared wavelengths alone have the capacity to rival and even enhance complex interventions like hyperbaric oxygen in overcoming severe tissue ischemia. To find the biochemical drivers of this acceleration, researchers extracted punch biopsies from the ischemic wounds and ran ELISA assays to track enzyme levels throughout the healing process. This upper graph maps the changing concentrations of vascular endothelial growth factor, or VEGF, a critical protein responsible for creating new blood vessels. The data reveals an immediate physiological reaction. In the group treated solely with LEDs, the concentration of VEGF spikes distinctly at day 4. By contrast, standalone hyperbaric oxygen therapy suppresses this early peak, delaying maximum VEGF until day 7. In the combined approach, LED therapy forces the early day 4 spike, while oxygen sustains it, creating an elevated curve of blood vessel generation across the first week.
Below, we see the data for basic fibroblast growth factor, which signals cells to multiply and repair damage. The LED-only treatment matches its vascular response, driving a massive surge in fibroblast concentration that peaks at day 4 and towers over the baseline control group. This precise biochemical sequencing is mandatory for survival. Dead tissue requires the simultaneous early upregulation of both of these growth factors to initiate immediate revascularization. The 880 nanometer light acts as a direct transcription trigger, forcing the tissue to synthesize critical angiogenic enzymes at the exact optimal moment to bypass the ischemic damage. With the enzymatic triggers identified, the question becomes how this massive release of growth factors dictates the rate of actual cellular reproduction. To measure precise DNA synthesis, researchers performed radio-labeled thymididine incorporation studies in vitro, directly exposing skin-derived fibroblasts and bone-derived osteoblasts to the LED arrays. These bar charts quantify the rate of DNA synthesis across both cell lines, plotted as a percentage change against untreated controls. During days 2 and 3, irradiated cells exhibits a massive surge in growth, replicating 150 to 200% faster than the control samples. Healthy regeneration relies on two safety mechanisms: growth phase specificity and contact inhibition. Tissues must know when to start growing and when to stop. At day 4, the data flatlines. There is a sharp, uniform drop-off in DNA synthesis across all irradiated cell lines, returning to baseline. Once the rapidly dividing cell cultures physically approach confluence, meaning they run out of open space in the dish, contact inhibition takes over. The LED irradiation completely ceases to accelerate growth. The therapy aggressively drives DNA synthesis when a deficit exists, but inherently respects standard cellular boundaries, completing the repair without triggering dangerous neoplastic overgrowth. To achieve these results in a human patient, the external light array must physically deliver photons through dense barriers of skin, fat, and muscle. Spectroscopic measurements demonstrate that wavelengths between 630 and 800 nanometers travel effectively through 23 centimeters of surface tissue, muscle, and bone. Once these photons reach the compromised tissue, they penetrate the cell membrane and are absorbed directly by cytochrome systems inside the mitochondria. This specific cytochrome absorption acts as an ignition switch. The light energy directly stimulates basic cellular metabolism, turning a sluggish, damaged cell back online. This mechanism is robust enough that deployed submarine crews operating in environments characterized by low oxygen and zero sunlight currently utilize these arrays to heal lacerations 50% faster than standard recovery times. By operating at these specific long wavelengths, the arrays bypass superficial layers entirely, delivering a direct metabolic power supply to the deep tissue cells that need it most. Because this technology is simply a highly precise delivery mechanism for cellular activation, its utility is not limited to regeneration. By altering the target, the exact same mechanism can be weaponized for destruction. Photodynamic therapy, or PDT, is an advanced oncology treatment that historically struggled to scale because it relied on narrow-beam, highly inefficient laser light. The therapy works by intravenously injecting patients with second-generation photosensitizers, like Lutex or benzoporphyrin derivative. Because of their specific chemical structures, these drugs preferentially accumulate inside the walls of tumor cells. Once saturated, clinicians irradiate the area with the LED array. The 680 nanometer beam perfectly aligns with the absorption peak of the trapped molecules. The light triggers a cataclysmic reaction, generating cytotoxic singlet oxygen that immediately ruptures the tumor cell from the inside. In vitro testing of this specific LED and drug combination has already yielded greater than a 50% cell kill rate in highly aggressive lines of canine glioma and human glioblastoma. Whether salvaging irradiated tissue or executing targeted tumor destruction, NASA's LED technology provides a biologically optimal, scalable tool to exert direct command over cellular metabolism.